So today we're having our 7th video on the COVID update. I just want to take a minute and thank everyone for everything they continue to do, taking incredible care of our patients, our community, and making sure that we're a leader in this process. I'd also like to thank our community who continually give very generously their time, their food, their supplies, and their funds. And it's just something it brings the community together, and it makes the people that work here know how much they're appreciated each and every day. So we realize that the pandemic that we're in is a marathon. We've known that all along, but we certainly are experiencing it more and more. You know, several weeks ago, our COVID positive patients were up into the 40s. We had some great trend down and ended up down into the single digits, and even for a time had no patients in the ICU. Unfortunately, we've had somewhat of a rebound and have more COVID positive patients in now. Today we're hitting 20 COVID positive patients, and we have 4 patients in the ICU. Even with this, still recognizing that COVID still only represents about 2 to 3% of our total population. And we continually to discharge patients that had been positive COVID and of course are now negative, and that number is in around 145 at this point. We have always prepared for the worst and hoped for the best. And I will tell you, while our cases have been down, we've continued to stockpile our PPE. We've continued to learn and adjust what we do here, and we are ready if we have another spike in cases. We're still watching very carefully. We're assessing every single patient and every person that walks into the organization. If you come to the hospital, you're going to notice still that we mask everyone. We take everyone's temperature. It's a very controlled environment. It's a very safe place to be. If you have any symptoms whatsoever, you're rapid tested and you're kept in isolation until we rule out COVID. We're certainly not out of the woods yet. We still have a long runway, unfortunately. The community can play a huge part in that by continuing to social distance, continuing to wear a mask when you're in public, and to be vigilant and make sure that you're doing the right things that the leaders in this community are telling you and nationally are telling you to do. I want to urge anyone who has had COVID and has been positive and is now cured to contact Suncoast blood banks. There is mounting evidence that using convalescent plasma could possibly help people. And so to the extent that that's possible, we want to certainly have as much resource as we possibly can. Another issue that's facing our community and really facing the country as a whole is a lack of blood throughout the country. So we would encourage everyone that is able to go to Suncoast Blood Bank and donate blood on a regular basis. Believe me, it's saving people's lives that are right here in our Suncoast area. So visitation is continually to be a big issue and something that we take seriously. We would love to open completely up and have it be like the good old days, but unfortunately we would need to protect our patients and protect our staff and protect the community's asset. So we are continuing to restrict visitation. We opened it up somewhat back on June 5th to allow some hours where people could come in, some one-on-one type of visits in certain different areas. We're continuing to monitor the effectiveness of that. So far it's working out okay, but if we have changes in COVID going into the future, whether it gets better for us or worse, we'll have to continue to modify those visitation rules. So we continue to see our volumes come back to somewhat of a normal stage. The first one we look at is our inpatient volumes, and our inpatient volumes have gotten back to where we're normally at this time of year. So what does that tell us? It tells us that patients are having the confidence that they can come in and get things taken care of that maybe they put off. So we are happy to be able to provide that service. As far as operating room cases, we're seeing those be back to where they were or even a little bit higher. Once again, things are going very smoothly in the OR, and our people are very busy, and our patients are getting the treatment they need. As far as emergency room visits, we're still seeing a bit of a less volume than we normally would have at this point in time, but our acuity is a lot higher in the ER. So We know people are coming in when they have emergencies to the ER. We want to make sure people come for all emergencies and not just when they get critically ill. The urgent cares also, they're ramping up and they're seeing more patients each and every day, more than the day before. So we're still a little bit lower than what we have been, but they're very safe places, and we encourage people to come into the urgent cares if you need that level of service. So when our volumes took a dramatic reduction in late March and early April, the organization did have to furlough employees from the organization. It's very hard for us to do that, but I am happy to report that we have been able to bring back 80% of those that were furloughed as of now. By the end of the month, we anticipate bringing back virtually everyone. So one of the things we're still getting used to is not being able to have big groups of in-person meetings, and it's certainly not our culture. We like to get together, we like to celebrate with each other, we like to prop each other up when we need to, when someone needs to. So we've started to put out our first Excel Award winners on video, and we're going to continue to do that every month and celebrate people that have really excelled at what they do here. We are also working right now on our service anniversary video. It's a shame we're not going to be in the auditorium with 300 people yelling and having a party and that type of thing this year, but we just want to recognize those people who have put in so much of their life towards this organization. And I just want to say thank you, and take a look at our videos and let us give us some feedback on them. As we all know, we live in Florida, and we live in an area that is prone to hurricanes. And so every year we need to make sure we prepare, whether we have a pandemic going on or whether we have just nice weather going on. So as every year, we are in the middle of preparations for hurricane season. We have all of our teams engaged. We have identified what we're going to do, how we're going to do it, and that type of thing. We're going to, of course, hope for the no hurricane season, but we're prepared if we have one. As we continue to return to the new normal, I want to continue to thank our staff for everything that you do. You come in each and every day, you take care of the sickest of the sick patients, you make this community better, and you have our gratitude. Thank you.